Sometimes kids sexually abused don't disclose until adulthood.
Are there any myths associated with how a child presents in effect when they disclose sexual abuse?
The common expectation is that if you're going to talk or disclose being sexually abused, you will be crying, distraught. In fact, there appears to be a lot of evidence to support the fact that kids accommodate or get used to the experience of being sexually abused. I don't want to say they become normalized, but they're not as traumatized, or those feelings aren't as acute. As a result, when they make the disclosure, it's usual for kids to make it in a somewhat matter-of-fact or detached way. They don't look acutely distraught and crying. Clearly, there are kids who disclose and are distressed. I think what Dr. Summit is trying to present is that he's trying to present that child who makes that disclosure, and they're not crying and they're not upset. It's not atypical.
Let's talk a little bit about the theories that Dr. Summit announced in his paper. Is the first called secrecy?
Yes.
And would you describe for the jury what Dr. Summit meant when he talked about the concept of secrecy in his paper?
In order to understand secrecy, it's important to understand the context in which sexual abuse happens. It occurs in a relationship. Usually children are sexually abused by somebody they know. That's important because children tell us there's been some strategy imposed upon them to keep them quiet about the abuse, hence the term secrecy. So the strategy can be lots of different things. It can be an overt threat. It can be, if you tell, then you'll go to jail, or I'll kill you, or I'll kill your mom or dad or you. Dr. Summit says in his uses an example, you'll go to an orphanage. Your parents will get divorced. Some type of coercive strategy imposed upon the child to keep them quiet about the victimization.
Did Dr. Summit discuss things that are other than direct threats?
Kids also tell us that they are bribed and provided special gifts. It doesn't necessarily have to be an overt threat. What I often explain to parents and children who come into therapy is clearly, if a child is being threatened, then a smart thing to do, if you're that child, would be to comply if the person who's threatening is bigger and stronger. But sometimes it can be a covert threat. If you see somebody beat up your mom and that person comes into your bedroom at night and wants to do something, then you should comply. Kids often feel like they could get in trouble if they were to disclose, and it's a topic that's not easy to talk about. Kids keep the secret about kids being abused because they're embarrassed, disgusted, or ashamed of what they participated in.
And is the next theory called helplessness?
Yes.
Would you describe for the jury what Dr. Summit meant when he talked about helplessness?
Sure. Essentially, the misperception is if you're a child and somebody approaches you with some overture to sexual abuse, you'll be able to do something about it, protect yourself, fend them off, prevent yourself from being sexually abused. Well, Dr. Summit points out the fact that that's not reasonable. In the face of a perpetrator who is bigger, stronger, smarter, more worldly, has more experiences, a child's not able to ensure their own sexual safety. They're not able to do anything to protect themselves. So Dr. Summit talks about the fact they're relatively helpless or vulnerable and relatively powerless.
Does Dr. Summit discuss kids being less able to protect their sexual safety?
Yes. Kids are relatively powerless when there's somebody who's in a position of authority or somebody bigger, stronger, and they are subordinate or submissive or weaker position than that person.
Does Dr. Summit talk about the causes of helplessness in the context of a known assailant or unknown assailant?
There's a context to the abusive relationship. Children abused by somebody with whom they have an ongoing relationship, and that person is bigger and stronger and inherently has more control over their life. If those two things are happening, acquaintance means there's ongoing contact, and the person is bigger, stronger, more authoritarian. That really serves to reinforce the strategies that are imposed upon kids. That is, if you're threatened to be quiet and you have ongoing contact with somebody who is both bigger, stronger, more powerful, and who has access to you, then that reinforces the notion that it is a really good idea for you to be quiet about the abuse.
Does Dr. Summit talk about abuse takes place in the context of a loving relationship, whether that makes the child even more vulnerable?
That would be a situation where a child would be perhaps most helpless, because if the perpetrator is somebody who's bigger, stronger, and in their family, then they have a fair amount of control over what the child does or says, or to be able to reinforce any type of threat that was made. And so, even though the child may care about or may even love the person with whom they're being abused, that doesn't negate the accommodation syndrome. It's not uncommon for kids to love the person that's abusing them and to be sexually abused by that person.
Is there anything discussed in Dr. Summit's article about whether helplessness is exaggerated or increased when the caretaker is someone who has a substance abuse problem?
We know from the research that children who have a caregiver who is in some way incapacitated are at greater risk to be sexually abused. An example I often use is a mother who's an alcoholic may do a relatively poor job of supervising the child, may fraternize with people who have problems or are somewhat unseemly. So the child would have more contact with someone like that. And so if there is some incapacity in the ability of the caregiving environment, like a mom or dad or babysitter, that would put the child at greater risk, make the child more vulnerable or more helpless.
Is there another topic in Dr. Summit's paper called entrapment in accommodation?
There are 5 parts to the accommodation syndrome. The third one is entrapment and accommodation.
Would you describe for the jury what Dr. Summit meant by that?
Entrapment and accommodation. The entrapment part is pretty simple. If the child is sexually abused and can't do anything to stop it, that's helplessness and can't tell anybody. That's the secrecy. They're trapped. Summit goes on to talk about how a child copes with or adjusts with or deals with experiences that they are forced to endure. He goes on to speak about some of the coping strategies that kids go through to be able to manage the unpleasant feelings that he experiences as a result of being abused.
Can you describe that a little bit more?
One of the things that happens with kids when they're sexually abused, there are a lot of unpleasant feelings, like being ashamed, a sense of humiliation or disgust, sometimes fear, sometimes even confusion. Not being old enough or appreciating what's happening to them. These are difficult feelings for them to experience and to tolerate. And we're finding in the mental health field for kids who are sexually abused, especially kids who are sexually abused at least a few times, they become somewhat numbed to those feelings because it's too difficult to tolerate.